Well, while the country was consumed last week with the presidential election, the coronavirus pandemic didn't go anywhere, of course. This week, the U.S. has reported over 727,000 new cases of COVID-19. That's a weekly record, and the U.S. is quickly approaching its record number of hospitalized patients. So as the pandemic reaches this critical point, President-elect Joe Biden is already meeting with his coronavirus task force, addressing the public about his approach to dealing with it. And let's talk about it a little. Let's break it down. Joining me now for the latest on this subject and the government response to the coronavirus is former President Trump's Homeland Security Advisor, Tom Bossert, and infectious disease Dr. Todd Ellering. Good afternoon to you both. Let me begin with Dr. Ellering. These hospitalization and death numbers are also up in addition to the case numbers. Multiple states setting new records every day. So where are we in the pandemic? Where do you see it going?
Terry, we're not in a good place right now because our baseline is so high. Think about this for a second. There's hundreds of thousands of cases each day, and we're approaching winter. We know that this virus loves the indoors, so you're going to expect cases to go up. Cases is not the biggest problem, but what happens when you have so many cases is it leads to greater hospitalizations. And that's the major problem you have, because when you start running out of hospital capacity and we can't take care of the COVID and, equally as important, the non-COVID patients, what happens is that's when you have to start getting these very stringent regulations and shutting things down and pausing on reopening and taking steps back. So we really have to get on top of this quickly.
And I'd like our audience to take a look at this video out of Naples, Italy. I don't know if you've seen it. Patients are being administered oxygen in their cars, in the parking lots, outside hospitals in the countries in Italy's southern region, as those hospitals fill up there. So is that where the U.S. is heading? That is such a dramatic and ominous picture. Is that something that could happen in the United States, given the pressure on our healthcare system?
Absolutely. You know that oftentimes Europe is ahead of us by weeks to even months. So what we see happening in Europe, we have to recognize could happen here.
That is truly an ominous prospect. So, Tom, let's go to how the leadership can respond. As President-elect Joe Biden already appointed and met with this coronavirus task force, is there anything he can really do right now between now and Inauguration Day, when it certainly looks to all purposes like he's going to lead the country, assume those powers? What can he do to get us through this pandemic in this time, or is it really up to President Trump until January 20th?
Well, you know, Terry, you just pointed it out. You hit the nail on the head by pointing out that the calendar for our political transition doesn't line up with the, interests of this virus. So what I can say is that I don't see any indication that President Trump's going to change his approach here. And what we need to do as a country is to change our approach now. The momentum that the doctor just described, people don't think of it this way. They think of linear growth. This is about to turn into geometric growth. You double, and then you double, then you double. The momentum that you pick up now is going to yield really, really terrible results in a month or 2 months' time. So in the next 70 days, before we get to the inauguration of a new president, we could see 400,000 new cases a day, or numbers along that order of magnitude. That is a staggering prospect. And if you think about then what a new administration will be inheriting, they'll be inheriting momentum that's very hard to arrest. So I would say two things. We need to speak deliberately to the governors and mayors of this country, and we have to speak to the people of this country. We don't want to repeat the mistakes we made of the spring, where we waited too long in hotspot areas like New York to put strict rules in place. We also don't want to overreact and put unnecessary controls in place in areas that are not yet hotspots or that don't have large amounts of virus. Now, unfortunately, where we are today, Terry, those things are flipped around on their ear, where over 30 states have seen these levels reach dire levels of terrible inflection points into this geometric, exponential growth curve. But nevertheless, that response, measured appropriately, is absolutely necessary today. And all President-elect Biden can do is offer his hopes, his encouragement, his bully pulpit leadership. I think President Trump has to really take this upon himself and not rely on the very good news about a vaccine, because the timetable for its delivery will not arrive in time.
This thing is still raging. And let me go back to Dr. Ellerin about that vaccine. Pfizer announcing initial data that indicated their trial vaccine is effective, but when will we really know for sure that it works? And what would come next? Give us a timetable. Give us your sense of where we are in the vaccine.
This is really exciting news. I will tell you, this result, more than 90% effectiveness, has exceeded all of our expectations. You've heard us all talk about, the FDA set a lower limit at 50%. So to think that this could potentially be preventing 90% of the disease that we see is really important. I do want to emphasize the fact, though, that we're still going to have to be masked and use the other infection prevention bundles and measures that we know about, because we still don't know these people who are getting infected, who have gotten the vaccine. We still don't know about whether they're less likely to transmit. So I cannot overemphasize that this is really exciting news today about effectiveness. We're going to hear about safety soon, probably in the next few weeks. And once we know that the effectiveness is great, which it sounds like, once we know that it's safe, then the company can apply to the FDA. I do want to say one other thing. Is that what's interesting about Pfizer in particular is that they are one company that did not receive any federal funding for their vaccine development. So I think that's very interesting, and I think they've done a terrific job. This has been unprecedented for all of the companies.
Good news in a hard time. Todd Ellerin and Tom Bossert, thanks very much for being with us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.